So we're looking here live at Capitol Hill. And we're going to be watching Capitol Hill very closely today for Robert F. Kennedy Jr. He's there this week, beginning meetings with Senate Republicans. Those will determine whether he'll be confirmed as Donald Trump's choice as HHS Secretary. That's Health and Human Services Secretary. And so this is key. These are key meetings for him because he would be in charge of public health for the United States. And of course, as we remember, when he was running for president independently, his slogan was "Make America Healthy Again." He is expected to face a difficult Senate confirmation battle because his views on vaccines, for example, have been controversial, and that has raised concern. Mitch McConnell, the outgoing Senate Republican leader, he had polio as a child, and just a couple of days ago, he has said that Robert F. Kennedy Jr. should steer clear of trying to discredit the polio vaccine. Now, RFK Jr. has said that he doesn't want to take vaccines away. He just wants more study, and he wants Americans to be able to make what he calls informed choices. But these are the kinds of issues that are going to come before senators as they begin their meetings with Robert F. Kennedy Jr. this week. Just thought we'd take a look at some of these issues with Dr. Christopher Labos, who's an epidemiologist and cardiologist, and he's in Montreal. Welcome, and good to see you, Dr. Labos, as always. So when we talk about Robert F. Kennedy Jr., on the polio vaccine specifically, the New York Times reported that a lawyer for him has petitioned the FDA, has petitioned federal regulators to withdraw the polio vaccine from the market. Let's talk about vaccines more broadly in just a moment, but specifically on the polio vaccine, what is the concern that they have, and what is the science about the polio vaccine that we should know about?
So their entire argument hinges on the fact that the vaccine that is used today is not exactly the same as the vaccine that was developed by Jonas Salk back in the 1950s, because it uses a slightly different technique for killing and activating the virus that is used to manufacture the vaccine. To me, that's a completely spurious argument because it's the same vaccine technology. There's just been a small technological innovation, but they're claiming that this vaccine is so completely different that it's been never studied. We have to redo the million children study to prove that it's effective. Basically, their argument is like with every iteration of the iPhone, Apple would have to restudy and relaunch their entire program because it's a completely different product, which again, just doesn't make any sense.
So that is specifically the polio vaccine, but experts have also expressed some concern because he's repeatedly spread misinformation about vaccines and the debunked theory that vaccines cause autism. He has been a very prominent anti-vaccine activist. So the thinking is that he will lead to a review of all vaccines and argue that the risks are greater than the benefits in that case. Broadly, what is the concern about that as a potential?
I think the concern is that we're going to start seeing more polio. We're going to start seeing more measles. We're going to start seeing a lot more of these childhood illnesses that we just don't see very much anymore. Because here's the thing, if your threshold for safety and efficacy is unreasonably high, nothing will ever meet it, right? If your argument is prove to me beyond the shadow of a doubt that this is going to eradicate 100% of all diseases all the time with zero side effects, nothing is going to live up to that standard. And so if that's where you're setting the bar, you could, in theory, just de-license everything. And all you have to do is cast a little bit of doubt in people's minds, because once vaccination rates fall even a little bit, even if they fall from 80-90% down to 60-70%, that's going to be enough for diseases to make a resurgence. And then you're going to have a lot of people getting sick and a lot of children paralyzed for the rest of their life with polio, which is not something anybody wants to see.
And as we watch in Canada, what health policy may be changing in the United States, think about people coming into Canada from the United States. If they have greater and greater numbers of unvaccinated, are there implications for us potentially?
Yeah, there are, because, I mean, here's the thing. We've eliminated polio in Canada, and yet we still do have polio cases occasionally, usually because of travel. When people go overseas, they're unvaccinated, they contract polio, they bring it back to Canada. Now, that usually happens in small enough numbers that when the outbreaks do happen, they are controllable. But if we start having large numbers of people from the United States crossing the border, bringing in polio, we could start having sustained transmission of polio here in Canada, community spread. And that's going to be really problematic because there are unvaccinated people in Canada. They're going to get sick. But even the rest of us that are fully vaccinated, you know, the polio vaccine is extremely effective. It's not 100% effective. And if you got your last booster dose when you were a child, and now you're in your 50s, 60s, or 70s, are you still immune from that dose? I mean, we don't know because we've never actually had to test that hypothesis. Does that then mean that we're going to have to start giving booster doses to adults? It may very well be the case. So I think there's a lot of worry and a lot of uncertainty that we've done really, really well at getting rid of polio in this country. What happens in the U.S. might actually cause it to come back.
It's really interesting. Hypotheticals, looking at all of them, and then the potential implications. It was interesting that 75 Nobel Prize winners talking about their concerns for science and for health policy. If Robert F. Kennedy Jr. was to be confirmed, they've gone to the public forum to say they are concerned about these kind of hypothetical situations, too, to watch. There are other areas, though, that are interesting. He supports withdrawing fluoride from drinking water, banning fluoridated water. We've talked about that in conjunction with decisions in Quebec just recently. What is the public health information there?
Well, I mean, there's a broad consensus amongst all public health people, and even the Public Health Agency of Montreal that said we should keep fluoridating the drinking water, and yet you have politicians doing the exact opposite of that. So, you know, it is important for dental health, right? We see less cavities when there is adequate amount of fluoride in drinking water. Some parts of the world have normal amounts of fluoride in their drinking water and they don't need to supplement it, but most of us here in North America do. And, you know, people make the argument, oh, but we can put fluoride in toothpaste and other stuff. We don't need to put it in the drinking water. That's fine, unless you are part of that segment of the population that doesn't have regular dental care, that maybe can't afford to buy these products and that are disadvantaged. The point of putting fluoride in drinking water is that it affects everybody, rich and poor alike. And that's the point of public health, to help everybody, not just the people who are kind of
One
off.
more last question, because this is an interesting one, and it's a timely one because we're watching instances where bird flu, and we're talking about it circulating in North America, and it has been showing up in samples of raw milk, but he is supporting increased access to raw milk. And there are many people who support that, thinking it tastes better or has health benefits. In fact, what's the science as you're reading it, Dr. Labos, on raw milk and pasteurization, and if that should be opened up, the concerns potentially there?
So the reason why people say raw milk tastes better is not because pasteurization changes the flavor. It's because they're drinking unhomogenized milk. So if you really like the taste, go out and get unhomogenized milk and, you know, whatever, more power to you. The point of pasteurization is to kill the bacteria and the viruses that are in milk. We started pasteurizing milk because children used to get tuberculosis from infected cows that were infecting their milk. And so if a cow gets sick, it can infect its milk, which then can go on and infect the child or the adult that ends up drinking it. So we've seen it with tuberculosis. We've seen it with bird flu. People are going to get sick if they, you know, Listeria, E. coli. We've had Listeria outbreaks before. People are going to get sick if they drink unpasteurized milk. And so if you like the taste, go get unhomogenized milk. Just make sure it's pasteurized so that it doesn't make you sick. That's the point.
This has become quite a thing on social media, too. So the whole thing about raw milk, it's good to talk. You love to debunk. So we always turn to you for some of these things. But we raise them because, again, in Washington, we will be watching closely as not just these first meetings, but again, getting into formal confirmation in the new year. Dr. Labos, thank you very much. Appreciate the time today.
My pleasure. Take care.